The United States has officially withdrawn from the World Health Organization, dealing a major blow to the UN's agency's funding as well as global health efforts. President Donald Trump's administration says the decision follows long-standing concerns over the World Health Organization's handling of the COVID-19 pandemic. Claims the organization strongly denies. For more on this, let's now speak to Professor Chris Isike, who's a professor of African politics and international relations in the Department of Political Sciences at the University of Pretoria. Prof. Isike, good afternoon. Compliments to you. Welcome to SA Today. So what do you think about Donald Trump's drastic move to remove the US from the WHO?
Good afternoon and happy New Year to you too. This is a move that has varying impacts for the world, including the US itself. So essentially, it will signal not just the failure or the inefficiency or ineffectiveness rather of the World Health Organization, but it also signals a broader crisis of multilateralism, where collective action to deal with collective problems are displaced, rather than resolving those problems. And the greatest risk really is not just the organizational weakness that this will have for the World Health Organization, but it will also mean a less coherent and more unequal global health system, which would be to the detriment of every country in the world, including, interestingly, the United States itself.
Mm-hmm. I mean, let's talk about the wider impact, Professor. Do you also see other, member states also joining in the fore? Because we've long heard these talks from Donald Trump that he was actually pushing for the removal of the United States from a various number of commitments that were made by the previous administration.
Well, not just the previous administration. He's always had this thing in his head that the international system is jigged in a way that screws, in this language, the United States, forgetting that the current world rules-based system that we have was put in place more than 80 years ago by the United States. And if you talk about globalization, which is the hallmark of all of these, the United States has benefited more from globalization and multilateralism more than any other country in the world. So the idea that America is being screwed over by these international organizations is patently, false. So he's removed the United States from a lot of these international organizations, like you mentioned, in the last couple of weeks, from 31 UN organizations and 32 others, right? And this is a problem, that will represent more than just a sectoral disruption in global health governance. It would actually constitute a shock to multilateralism, like I said before, and implications can be assessed across a number of interrelated dimensions, from norm setting, power distribution, and the collective, capacity of the world, to act. And my closing statement would just be that there will be no vacuum simply because the United States, which is the biggest funder of the World Health Organization, is leaving. Of course, it will impact its operation. It can become less effective, but there will be other players who would step in, and some of them are already doing so. China, for example, other countries, middle powers, will also do the same thing. And we've seen a call for collective action by middle power countries to come together to ensure that we act collectively and discourage an idea of might is right approach to foreign policy.
But I mean, his reasoning, as always, Professor, he says that the decision follows long-standing concerns over the World Health Organization's handling of the COVID-19 pandemic. I mean, let's talk about the wider impact on Americans now, who have long had a serious healthcare funding crisis since, of course, the banning of the Obamacare.
Absolutely. You would see that if you talk about COVID, the United States was most affected by COVID if you look at the number of deaths per million of population than any country in the world. And that is an anomaly for a country that is supposed to be the richest country in the world. The difference is in the political system that they have compared to their neighbors, for example, Canada, that have the same physiological demography as the United States, but were less impacted. The difference is in the political system. Canada has a social democracy system where the state assumes, responsibility for public health, public education that benefits all of its citizens, and so we're better prepared compared to a liberal democracy like the United States that does everything for profit, including the provision of health care. And so that's why you see that people who could not afford health care in the US died, in such high numbers, and that's a problem. So there is a need for the world to actually mandate what I call global public health, where every country is supposed to be made responsible for ensuring that it has public health care for its citizens. Because what COVID showed us was that contrary to beliefs before then that the world was the world is the economy is the backbone of politics and every other thing. It's actually human well-being, because if people are ill, they cannot go to work, there's no economy. So that kind of rethinking should be what frames how we begin to approach public health going forward. And like I said before, if this carries on, the United States will be also affected because there is no public health system in place right now. The only one they have, which is the Obamacare, is being. They also want it out because it doesn't favor the profit motive of a liberal democratic system.
Very true. I mean, the Assistant to the President for National Security Affairs there says they shall establish the directorate as well as coordinating mechanisms within the National Security Council apparatus as he deems necessary and then appropriate to safeguard public health and fortify biosecurity. Quite interesting. We're going to see how this rolls out. Professor, as always, great engagement there. We're going to leave it there. That is Professor Christopher Isike, who's a professor of African politics and international relations in the Department of Political Sciences at the University of Pretoria.